Placing IVs in infants is notoriously difficult due to their small veins, excess adipose tissue, and high mobility. The goal is to secure IV access efficiently, minimizing pain and complications. Here are key tips and tricks drawn from extensive experience in pediatric care. For infants, a 24-gauge IV is typically ideal. This size ensures adequate flow without risking vein rupture, which is crucial given the small volume needed for infants. Shorter 24-gauge catheters are preferred for their ease of placement and higher flow rates, reducing the risk of vein blowout. Here are 5 sites to consider when starting an IV on an infant. Foot. This site is favored due to the prominent veins and ease of immobilization. Transillumination with a bright light can aid in vein visualization. AC. Antecubital fossa. A good option if accessible, but requires an arm board for stabilization. Hand. Useful for transillumination, though securing the IV can be challenging. Use a gauze platform to stabilize the IV hub. Scalp. Ideal for emergency situations. Avoid open sutures and ensure proper capping to prevent air embolism. Lower leg. A last resort due to deep vein placement. Use caution to avoid arteries. To locate veins, use transillumination with a bright light. A small mag light, otoscope, or phone flashlight can be effective. Warming the area with a glove filled with warm water may also help. Avoid using hot packs directly on the infant's skin to prevent burns. Stabilizing the placement site or infant during IV insertion is important to success. Use a papoose wrap for infants and have additional personnel or a parent help hold the infant steady. Apply opposing forces at the joints to prevent movement, ensuring a stable procedure for higher success rates. Always take time to find the right site, use a 24-gauge IV, and enlist help for stabilization. These steps will enhance your success rate in pediatric IV placements.